It Real, powered by Ned Group Life. Let's make it happen. Today on Keep It Real, we've tracked down the experts to help us to know the difference between a physiotherapist, a chiropractor and a biokineticist, and when it's appropriate to use which one. Theo, there seems to be quite a misconception when it comes to using a physio, bio or chiro. When does one need to use one of these?
The patient's always put first, and one must fall into a model where you have a multidisciplinary approach. Ideally, one would see a sports physician or a doctor, and then they would refer on to see either a physio, a chiropractor, or a biokineticist. Just to explain it in short, when a person does get injured, one goes through certain phases of healing. You'll go through an inflammatory phase, as an example, in the first 4 days. And in doing that, you need to obviously have the specialist with the best skills to treat that condition at that time. And that'll be your physiotherapist coming in the acute phases. You'll then go through the repair phase where your physio will then once again go through your muscle activation sequences, try and get the person as functional as possible and with the minimal pain pertain to their movements. From there, one can then objectively take the development of the patient through and refer on to a biokineticist for final phase. Or if there's a structural problem with the spine, one can then take the decision and refer on through to a chiropractor who can do the necessary manipulation needed in order to progress the client along his program.
Why would one actually use a chiropractor and what are the benefits?
Well, if there's malalignment, in layman's terms, the cause of the spine, but that needs to be diagnosed and indicated, then it'll be necessary to see a chiropractor for that. If there should be any leg length discrepancies that one can pick up that needs force manipulation, and that is obviously clinically calculated, then that will also be indicated. But once again, manipulations must be guided and they mustn't be done forcefully, otherwise you can actually cause more damage.
Low back pain seems to be very common amongst people out there, and the first thing people do is seem to think, I'm going to go have my back licked and I'll be sorted out, but that's just a quick fix. What would you suggest for people?
It's a temporary fix and it's very narrow-minded, because if you look at your back, it's not only the spine. You have nerves, you have blood vessels, you have organs, you have muscles, you have fascia. There's a lot of components around it, so looking at it with blinkers, you're only dealing with maybe 10% of the problem. The rest of the 90% needs to come through with other specialists into the field, and we will, like I said, need to work in a team to get to the end result of having no pain.
So how does it work? You go and see your GP first, and then they're going to refer you on to your biokineticist or your chiro or your physio. How does that work?
More or less, it can vary where the doctor might make the decision themselves and say, listen, I think you need your spine manipulated, and send directly to the chiro and then send through to the physio for rehabilitation. Depends whether the client is acutely inflamed. In other words, they have swelling in the area, there's a lot of pathology involved, etc. You need to settle that pathology first before you go and manipulate and re-aggravate the joint again, or the tissue involved.
So moral of the story, have a good GP.
Yes, absolutely. That knows what you're doing. You must know your diagnosis, and if you understand what you're treating, you can treat that better.
Do you have to be injured to be seen by a biokineticist?
Not at all. We do general exercises. We work with people that might want to lose some weight. We also do sport-specific type of exercises and training. And generally, we will do a postural assessment to actually have a look and see if there is anything wrong with you from the start. And if there's any form of deformities, we will then strengthen those muscles to get you back to where you should be.
So what is the difference then between a bio and a personal trainer?
Biokineticist is allowed to do the rehab side of things, where personal trainer is only allowed to do the fitness side of things. So we'll incorporate general exercises as well as rehab exercises to strengthen the person back.
So you'll get the referrals from the physio and the chiros first?
The referral basis is a lot stronger in the sense that we're allowed to do the rehab, and then we'll do the general exercises after that.
And now for today's financial savvy tip. Estate planning is when you structure your assets to ensure that on your death, your dependents will be left with enough income to survive. To find out more about today's show and our featured experts and the chance to win awesome daily and weekly prizes, log on to keepitreal.co.za. Every professional has their place, but it's important to know the difference to improve the effectiveness of the treatment and also to prevent further injury. That's it from me, Lisa Raleigh. Remember to keep it real. Until next time. Keep It Real, brought to you by Ned Group Life. Let's make it happen.